Hello everyone, I'm Dr. Sean Liu, your knee specialist orthopedic surgeon who is dedicated to helping you to move with ease and confidence. Today, I'd like to talk to you about an innovative advancement in knee surgery, robotic total knee replacement, and how it might be the solution you have been searching for. First, let's understand what a total knee replacement is. It's a surgical procedure where we replace the damaged surfaces of your knee joint with artificial components. It can significantly reduce pain and restore function, allowing you to return to the activities that you love. However, traditional knee replacement isn't without its challenges. We typically use intramedullary guiding jigs, which are instruments inserted into your bone medullary canal to help align the new joints precisely. But for patients who have had previous fractures or bone deformities, what we call malunion deformities, these guides can be less accurate and even unusable. Additionally, patients with a higher body mass index face unique obstacles. Obesity can make it difficult to position these traditional guides accurately. Often, it requires longer incisions and potentially leading to extended recovery times. This is where robotic-assisted surgery comes into play. Using advanced robotic systems, we can create a highly accurate 3D model of your knee before the surgery. This technology allows for personalized surgical planning, tailoring the procedure to your unique anatomy, greater precision in implant placement, which can improve the knee joint's function and longevity, minimally invasive techniques, often resulting in small incisions, less pain, and quicker recovery. Imagine standing and walking short distances the very next day, feeling more stable and experiencing less discomfort. Of course, it's important to consider all aspects. Robotic surgery can be more costly, and not all medical facilities have access to this technology. However, whether you choose traditional or robotic-assisted surgery, what truly matters is the expertise of the surgeon. In experienced hands, both methods yield equally good results. If knee pain for osteoarthritis is holding you back, now is the perfect time to explore your options. Advances in surgical techniques mean you don't have to live with discomfort. Your journey to a pain-free life starts here. Take that first step today.